I've read over the Biden administration's statement of drug policy priorities for year one, and I appreciate your testimony about the importance of follow-on services for people who are released from incarceration so that they don't repeat their mistakes. And to that end, Senator Whitehouse and I recently introduced a bill called the Residential Substance Use Disorder Treatment Act of 2021, which would expand the use of would expand access to substance use treatments in jails and prisons. So certainly with you on that, and want to continue to support those efforts. In my state, in Texas, part of what we did on prison reform is help give people access to programs when they're in prison and hope they don't recidivate once they get out, but it really required follow-on services. We can't just expect that we're going to let somebody out of prison and then they're not going to go back in the same old neighborhood and be exposed to the same old temptations, perhaps, and the same old associates. But other than supporting the high-density drug trafficking areas program and attempting to work with commercial carriers to intercept synthetic drugs being moved through postal and parcel systems, what do you intend to do in your office to improve domestic drug enforcement?
Thank you, Senator, for that question. So ONDCP, as you said, has many aspects to it. What we try to do is look at source countries, so Colombia, Mexico, et cetera, and that's the first step. Keep the drugs from coming into the United States. And as you asked about domestic work, we have the high-intensity drug trafficking areas program, and they work extensively with their state and local partners to disrupt drug trafficking. And so a lot of our work is really focused on working with the HIDAs, having partnerships with the Drug Enforcement Administration, and making sure that all the pieces are in place to support law enforcement, first of all, to divert people away from the criminal justice system, to support law enforcement to disrupt drug trafficking networks, and then lastly, for people who are involved in criminal justice, as you said, making sure they get the supports they need both while they're incarcerated and upon reentry.
Do you recall how many Americans died of drug overdoses in the last year?
Certainly, sir. There are 92,000. That's as of October 2020.
And do you agree with me that a lot of those drugs come across our southwestern border?
So what we know is that 75% of the 92,000 overdose deaths involved fentanyl. And fentanyl, right now, the most of the fentanyl is coming from Mexico.
And 90% of the heroin that comes to this country comes from Mexico, too. Do you agree with that figure?
I believe that's the current figure.
Okay. So we ought to all be concerned, should we not? Shouldn't the Biden administration be concerned about the overwhelming flood of people coming at the border, including unaccompanied children, and diverting the Border Patrol from their law enforcement function to taking care of these unaccompanied children? Shouldn't that be a matter of concern?
So what ONDCP is doing, and yesterday actually I met with the Mexican ambassador to the United States, is talking to them about their ports, about the fentanyl coming into their country, to keep it from even getting to the border. So disrupting labs in Mexico, and so those are many of the high-level dialogues that we're having with Mexican officials.
So do you know how much of Mexico is controlled by the cartels as opposed to the government?
It's significant. Sir.
Right. It is significant. It's frightening, in fact. And you didn't answer my question about diverting Border Patrol, but we'll move on to something else. Governor Hutchinson, I have a lot of respect for your public service, and certainly I've followed it and worked with you off and on over the years. I'm trying to figure out how this disparity issue would apply in other contexts, not just to cocaine, crack versus powder. Because if you had the little bags of flour that Senator Durbin had that he showed with the 18-to-1 disparity, and you had heroin in one, and you had fentanyl in another, there would be fentanyl is a whole lot more powerful, as I understand it, than heroin. And I'm just wondering, across different types of opioids, let's say, for example, prescription drugs, heroin, and fentanyl, do you think this same principle can be applied? And I'm just wondering how that would work.
I think that's an excellent question, and I think there is a reason for a broader discussion about our sentencing policy in relation to drugs. They're ultimately set by Congress, and you have to look at the impact. You have to look at the chemical qualities of it. I think we've made determination based upon science as the similarity between crack and powder cocaine, but obviously there's distinctions between fentanyl, which deserves all of the resources and investigation that's possible because of the harm that is being done. And so I think those are very good discussions. I do believe, as I said, that quantity is not always the best indicator as to culpability and consequences and punishment. So it should be many more factors simply than quantity.
Thanks, Senator Cornyn. Senator White.